Now we'll see the other topic of anti-thyroid drugs. So the name itself indicates these are the drugs which are used to antagonize or reduce the action of thyroid hormone. So we know that too much secretion of the thyroid gland or as too much secretion from the thyroid gland leads to a condition called as hyperthyroidism. So the increased action of the thyroid hormone is called hyperthyroidism. So hyperthyroidism is also called as thyrotoxicosis, that is the toxicity which is caused because of the thyroid hormones and overactive thyroid. So because of the overstimulation of the thyroid gland, overactivation of the thyroid gland, it is releasing excessive thyroid hormones. So this thyroid hyperthyroidism, it is an autoimmune disorder. So this is a disorder which is related to the immune system and thereby it is an antibody mediated disorder. So this is an antibody mediated because of the antibody stimulation in the body. It causes excessive activation of the thyroid gland leading to the over secretion of the thyroid hormones, and this leads, in this condition there will be excessive secretion of T3 as well as T4 hormones from the thyroid gland. What are the complications of this thyroid hyperthyroidism? So if this hyperthyroidism it is untreated, it may lead to severe heart problems and it will lead to brittle bones. The bones will be easily breakable and it causes eye problems. There will be swollen eyes and there will be a red coloration observed in the eyes. So because of the red coloration and swollen eyes, sometimes it may lead to a condition called conjunctivitis and there will be thyrotoxic crisis. So there occurs severe thyrotoxicity. So toxicity occurs because of the thyroid hormones. What are the signs and symptoms? So how we can say that the person is suffering from the hyperthyroidism? So the signs and symptoms include there will be shaking, the person will be shivering and he'll be very sensitive also, and it causes increased nervousness. So there will be excessive stimulation of the CNS and there will be rapid heartbeat. The heartbeat will be raised to its normal and the person feels hot. The temperature increased, there will be the temperature increased inside the body is more. So there will be the person feels sweating and the person feels hot, and there will be weight loss, there will be fatigue, person becomes tired and more frequent bowel movements. So increased stools can be observed. Now let us see the classification of the anti-thyroid drugs, or what are the drugs which are used in the treatment of hyperthyroidism. So there are various classes of drugs. The first class is that the drugs which inhibit the hormone synthesis. So whatever the hormones which are synthesized, the synthesis mechanism is inhibited by the drugs like propylthiouracil, methimazole and carbimazole. The other one is they inhibit the iodine trapping. So there are various steps involved in the synthesis of this thyroid hormone. So first step is that iodine uptake or iodine trapping. So this mechanism is inhibited by the drugs like thiocyanates, perchlorates and nitrates. So these are the ionic inhibitors. And the other one is they inhibit the hormone release. So once the hormones are synthesized, they are stored, and in order to inhibit the release from the storage vesicles, the drugs like iodine and the salts of iodine, the sodium and potassium salts of iodine and organic iodide is used, and the other one is they destroy the thyroid tissue. So these are the drugs, the radioactive thyroids, the radioactive isotopes like I-131, I-125 and I-123. So these are the isotopes of these are the isotopes of the iodine whereby they completely destroy the thyroidal tissue. Now let us see the first category of drugs, that is thioamides or antithyroid drugs. These are the drugs which inhibit the thyroid hormone synthesis. So here the drugs include propylthiouracil, methimazole and carbimazole. If we see the structure, these structures are containing thiocarbamide. Thiocarbamide in the sense they are having a ring structure whereby the double bond sulfur group is attached to each and every structure. So here this double bond sulfur group, it is thio. Thio means sulfur. So this sulfur atom is attached to the carbamide ring. So that is the reason this active part, this thiocarbamide is the active group which is aiding in the anti-thyroid activity of these drugs. So if we see the mechanism of action, there are various steps involved in the mechanism. So here they act against iodide organification. So here the iodine oxidation is taking place. So in the synthesis where the iodine is getting oxidized, that mechanism is inhibited by these drugs. The other one is they inhibit the coupling of the iodotyrosine. So I told you there occurs the coupling. So the tyrosine or the tyrosine groups are there. These tyrosine groups, they get coupled and they form the T3 and T4. So this coupling mechanism is inhibited by these drugs. The other one is it blocks the peripheral conversion of T4 to T3. The final step is that in the periphery the T4 is converted to T3 by deiodination. So this process is inhibited. So in the biosynthesis mechanism, the various steps are inhibited by the drugs of these thioamides. So here we can see the action of the thioamides. So these thioamides, they are acting in the oxidation. So especially the conversion of the I-, that is ionic form of iodine to oxidative form of iodine. This is inhibited by thioamides. At the same time, the conversion of thyroxine T4 to T3 is also inhibited along with the coupling mechanism. Now let us see the pharmacokinetics of these drugs. So these drugs are better absorbed in the GIT when compared to other parts, and the half-life of T4 is about 90 minutes. That is, the half-life of PTU, PTU, that is thiouracil, propyl thiouracil. The T half of propyl thiouracil is about 90 minutes, and methimazole T half is about 6 hours. And the excretion, so this propyl thiouracil is excreted for every 24 hours. In the sense, the excretion of the PTU is of 24 hours and is excreted through kidney, and methimazole is excreted for every 48 hours out of the body. These drugs, methimazole can cross placental barrier when compared to propyl thiouracil. So the crossing of the capacity of crossing of the this placental barrier is more for about methimazole when compared to the propyl thiouracil, and but this methimazole is more potent. It's almost 10 times more potent than propyl thiouracil, and this propyl thiouracil is having greater affinity for plasma proteins. So it binds to the plasma proteins and thereby it is getting excreted. Let us see the uses of these thioamides. So these thioamides are used in order for Graves' disease. So this is we can say it is also complete destroy of the thyroid gland. So it is a condition where there occurs complete destroyal of the thyroid gland, and toxic nodular goiter. And in preoperatively, it is used in thyrotoxic patients, and it is used along with RAI, that is radioactive iodine. Now let us see the adverse effects. So what happens if these drugs are used for chronic period? So it causes maculopapular rash. So this is a kind of a rash, in the sense there will be a flat red color rash on the skin, and thereby it is covered by a blister. So first there will be red coloration rash, and there will be a bump on that rash, and thereby the other adverse effect is benign transient leukopenia. So this is a cancer which is caused because of the low white blood cells. And agranulocytes is a condition where there will be the decreased count of, or there will be no granulocytes present in the body. And hepatitis and cholestatic jaundice, there will be jaundice, and vasculitis and lupus-like syndrome. So lupus-like syndrome is a condition where we can see the butterfly rashes on the cheeks. So there will be butterfly rashes in this area, and thereby it causes it leads to fatigue of the person. Now let us see the other category of the drugs, that is ionic inhibitors. So ionic inhibitors act by the mechanism of the iodine uptake. So here they block the iodine uptake mechanism. So whatever we take through, whatever the iodine we take through diet, so the iodine uptake from the diet is inhibited by these drugs, and these are the monovalent ions, in the sense they contain only one anion. They contain only one charge. If we see this perchlorates, SCN minus. So these nitrates, so NO minus, so these are the monovalent ions, and they inhibit the iodine uptake mechanism, and they can be overcome by large doses of iodides. So here if we have to use the large doses of iodides, these perchlorates can replace that mechanism, and they are useful for iodide induced hyperthyroidism. So because of the over uptake of the iodine, whatever the hyperthyroidism which is caused because of the over uptake of iodine, that can be inhibited by these drugs, and it causes the aplastic anemia in rare conditions. So aplastic anemia is a condition where there occurs destroyal of white blood cells in the body. So if the white blood cells are getting destroyed, the person is more prone to infection. So if there occurs the destroyal of white blood cells, then it leads to a condition called aplastic anemia. So this iodides on increased dose, or they may cause the adverse effect, but this adverse effect is very rare. The iodine and iodides. So these iodine and iodides, they aid in the inhibition of the iodine organification. So here the organification in the sense the oxidation. So whatever the after the storage, after the synthesis or after the release of the this thyroid hormone, whatever the organification, whatever the biotransformations occurring in the iodine, that is blocked by these iodine and iodides. So these iodine and iodides, they are required in large doses in order to prevent the hyperthyroidism, and on higher concentration only they can inhibit the thyroid hormone released from the thyroidal gland, and they decrease the size and vascularity of the hypoplastic gland. So if the vascularity and the perfusion capacity of the thyroid gland is decreased, thereby the hormone cannot be secreted. These iodines and iodides, they are used in preoperative preparation of thyroidectomy. So in order to remove the thyroid gland completely, whatever the operative procedure is involved in this, so this drugs are used preoperatively for this operation. And thyroid storm. So thyroid storm is a condition of untreated hyperthyroidism. So if the hyperthyroidism is untreated, whatever the severe consequences are faced, that is called thyroid storm, and in the prophylaxis of endemic goiter, as well as it is used as an antiseptic. The adverse effects which are observed because of the iodides and iodines are, it causes acneiform rash, the rash which is caused because of the acne, and there will be swelling of the salivary glands, and it causes some sort of ulcerations in the mucous membrane. So the mucous membrane degradation takes place, leading to the ulcers which are formed in the mucous membrane, and it causes conjunctivitis, that is redness and inflammation of the pupil of the eye. The other one is radioactive isotopes. So these radioactive isotopes are, this iodine is mainly used in the isotopes of I-131, 125 and 123. And this radioactive isotope mechanism is the best therapy, and it is the most common therapy recommended in the US. And in India it is rarely used, but it is effective. And the T-half of these radioactive isotopes is about for 8 days. So if they are once administered, they last in the systemic circulation for 8 days, and they are rapidly and efficiently trapped by the thyroid. So this thyroid, it is in the sense this thyroid, the thyroid gland mistakes these radioactive isotopes for iodine. So instead of iodine, it uptakes the radioactive isotopes, and these radioactive isotopes, after entering into the thyroid gland, they completely destroy the thyroid tissue. And so here the dose is determined by preliminary uptake test. So as these radioactive isotopes are also dose dependent, so on increase in the dose they may cause adverse effects. So that is the reason before administering the dose, the preliminary tests are conducted in order to decide the dose based on the severity of the hyperthyroidism. And after the preliminary tests are done, the dose is adjusted and thereby it is given. Now let us see the pharmacological effects of this I-131. So this I-131, it shows the absorbed and concentrated. In the sense, this I-131, it is greaterly, as I told you, it is rapidly absorbed by this thyroid gland. So once it enters into the thyroid gland, it destroys the thyroidal tissue. And these radioactive isotopes, they are in the two forms. One is beta form and the other one is gamma form. So, but this beta form is of 99%. In the sense, the beta form of isotope is more absorbed when compared to the gamma form, and it is getting, it gets rapidly trapped by the thyroid gland, and the beta particles, whatever the radioisotopes, whatever the beta particles are present in the radioisotope formulation, they destroy the parenchymal cells of the thyroid gland. These radioactive isotopes are used to treat hyperthyroidism, and along with they are used to diagnose the disorders related to the thyroid gland. And on long-term uses, it causes adverse effects like hypothyroidism. So, if there is excessive inhibition of the biosynthesis of thyroid hormones, it lead to the lesser secretion of thyroid hormones, leading to a condition called hypothyroidism, and this is contraindicated in pregnant women. The last class of drugs are beta blocking agents. So beta blocking agents are the drugs which are having various pharmacological actions, and they are clinically used in various disorders like antihypertensive, anti-arrhythmia, as well as they are used as adrenergic agonists in adrenergic agonists, as well as they are used as adrenergic antagonists. So these drugs are also even having the anti-thyroid effect. So mainly the drug which is having the anti-thyroid effect is propranolol. So propranolol is a beta blocking agent which is effective for tremor, anxiety and nervousness which are caused because of the hyperthyroidism. So whatever the severity, because of the severity of the hyperthyroidism, the tremors, anxiety and nervousness which are caused, so this propranolol is recommended in order to antagonize the signs and symptoms of the hyperthyroidism. The adverse effects of these beta blocking agents include, on long term use, it may cause the cardiac failure, it causes cardiac arrest, and it causes bronchial asthma. It leads to the bronchoconstriction and thereby leading to the asthma and atrioventricular conduction block. So here the impulses are in the heart are generated through the AV node, that is atrioventricular node. So whatever the impulses which are generated, we can say SA node and AV node are also called as pacemakers of the heart. So here the impulsive conduction which is conducted through the AV node, that is blocked on the severe usage of this propranolol.